Have you ever thought about how something as seemingly harmless as a scratch or a tiny puncture could put your life at risk? In this video, we will explore the hidden dangers of tetanus, a disease that many still don't truly understand. Tetanus isn't caused by just any bacteria. It's the result of a unique and highly dangerous microorganism, Clostridium tetani. This bacterium is not just lurking in rusty nails, as many believe. It's everywhere, silently waiting for an opportunity to strike. By watching this video to the end, you'll uncover the chilling truth about tetanus, including how it spreads and how it impacts your nervous system, turning your body into a battleground. Tetanus is more common than you might think, and the spores responsible for this deadly disease are found in places you'd least expect, like dust, soil, and even your skin. We'll dive into the terrifying effects of the toxins these spores release and how they can paralyze not just your muscles, but also the vital systems that keep you alive, like your heart and lungs. But it's not all doom and gloom. Knowledge is power, and by the end of this video, you'll learn practical steps to protect yourself and your loved ones from this potentially life-threatening disease. We'll cover the symptoms to watch out for, the types of tetanus, and, most importantly, how vaccination can keep you safe. Stay with us to gain the knowledge that could save your life, or the life of someone you care about. Let's get started. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. Welcome to today's video, where we will explore something that, despite its danger, many people still don't truly understand: tetanus. This potentially life-threatening disease isn't caused by just any bacteria. It is the result of a unique and highly dangerous microorganism. What makes this bacterium so particularly frightening is its ability to produce spores, and these spores are the reason why tetanus is such a complex, elusive, and insidious threat. To truly appreciate how terrifying this disease can be, we need to look deeper into how these spores work. Tetanus, an acute and deadly infectious disease, is caused by Clostridium tetani, a type of bacteria that has learned to survive in the harshest environments. You may have heard that tetanus is often associated with stepping on a rusty nail, but that's just the surface of it. The Clostridium tetani spores are far more ubiquitous than most people realize. These spores are present in many common places: soil, animal intestines, human intestines, and even on the surface of your skin. If you've ever been outside or touched an old tool, you've likely encountered these spores without even realizing it. But the truth is even more unsettling. Clostridium tetani spores can also be found in dust. Yes, dust, the seemingly harmless substance that coats almost every surface in the world. Can you think of a place where dust doesn't exist? That's right. It's everywhere, and so are these spores, silently waiting to strike. What's truly horrifying is just how resilient these spores are. They're not your average bacteria. They are survivors, able to withstand extreme temperatures, whether freezing cold or scorching heat, and resist most antiseptics that are typically used to kill harmful bacteria. This resilience makes Clostridium tetani spores incredibly difficult to eradicate. Once they're on a surface, they can linger there for an extended period of time, patiently waiting for their opportunity to infect. The worst part: you may not even know that they're there until it's too late. It's like living with an invisible threat that you can't see, touch, or smell. This is the insidious nature of tetanus. These spores are silently hiding, waiting for an opportunity to make their deadly move. And this brings us to an even more unsettling truth. Tetanus is more common than we realize. It's not just about stepping on a rusty nail or using an old, corroded tool. In fact, because these spores are so widespread, you're far more likely to contract tetanus from a simple fall or a minor scrape than from a piece of rusty metal. The risk is everywhere, and because we can't always see or control it, the danger is ever present. Now, let's talk about how tetanus actually enters your body. The The spores of Clostridium tetani don't need much to get inside. They only need a small break in your skin. A scratch, a scrape, or even a small puncture is all it takes. And once inside, this is where things get truly frightening. The spores start to germinate and produce toxins, potent and deadly toxins, that begin wreaking havoc on your body. There are two powerful exotoxins involved in the progression of tetanus, and the first, tetanospasmin, is the one you really need to be concerned about. This is a chain of peptides that moves through your bloodstream with one mission: to affect your nervous system. It seeks out and binds to your nerves, and from there, it begins traveling upward toward your spinal cord and brain. But it doesn't stop there. The toxin also travels downward, affecting the very core of your nerve cells, both the axons and the soma, and in the process, it blocks the release of neurotransmitters like glycin and GABA. This is where the real nightmare of tetanus begins. GABA is a neurotransmitter that plays an essential role in helping your body relax and unwind. Without it, your body can't calm down. Muscles that should be relaxed are instead in a constant state of contraction. This is where tetanus becomes not just a simple disease, but a full-body ordeal. Imagine being unable to relax your muscles, constantly tense, every muscle in your body locked in a painful spasm. It's a terrifying thought. Your body is no longer under your control. Instead of having the ability to relax and rest, you are stuck in an endless, excruciating loop of tension and pain. This is the horrific reality of tetanus, and it only gets worse from here. What makes tetanus so incredibly dangerous is that it doesn't just affect the muscles you consciously control. While the initial effects may start with voluntary muscles, those in your hands, wrists, or fingers, the toxins don't stop there. Tetanus also impacts the involuntary muscles that you don't have control over, the ones that keep your heart beating, your lungs breathing, and your intestines moving. Your heart, your breathing, your very ability to stay alive, can be threatened by tetanus. These toxins can stop your heart from beating properly, cause your breathing to become erratic, and even paralyze your intestines, stopping them from working. Imagine the horror of being trapped in a body that no longer obeys your commands. You can't move the way you want, and you can't breathe or keep your heart pumping like you need to. Your body is failing you, and all because of an invisible threat that entered through the tiniest of openings in your skin. This is the devastating power of tetanus. If you are still watching this video, and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Understanding how tetanus spreads and how it affects your body is not just important, it is crucial. This is the kind of knowledge that could make the difference between life and death. The more you know about how tetanus works, the better equipped you'll be to protect yourself from it. In this video, we're going to take a closer look at the ways you can prevent tetanus, how to recognize the symptoms if you're infected, and most importantly, how to stay safe. Because with tetanus, the threat is never as far away as you might think. This disease can strike anyone at any time, and knowing the signs and symptoms, as well as how to protect yourself, is the first step in fighting back. Stay tuned, and let's ensure that you're well informed and prepared to stay safe in this world where dangers are sometimes hidden in the most unexpected places. The clinical manifestations of tetanus are diverse and can present in a range of ways, which makes recognizing the disease all the more challenging. While some symptoms are common, the initial signs may not always be as predictable as one might think. One of the most alarming early symptoms of tetanus is fever, accompanied by muscle stiffness, which gradually intensifies as the disease progresses. As the infection advances, a condition known as dysautonomia can occur, where the autonomic nervous system, responsible for regulating involuntary functions like heart rate and blood pressure, becomes severely disrupted. This can lead to serious, painful, and potentially life-threatening complications. The disease's progression is driven by two primary exotoxins produced by Clostridium tetani, and it's essential to understand their roles in this process. The first exotoxin, tetanospasmin, is responsible for much of the paralysis and muscle spasms, but there's a second toxin called tetanolysin. While scientists haven't yet fully deciphered all of its roles in tetanus, We know that it contributes to the bacteria's ability to travel through the bloodstream and reach other areas of the body, worsening the overall infection. While tetanolysin may not be as well understood as tetanospasmin, its significance cannot be overlooked. It is a critical component of the disease's spread, and recognizing its impact helps us better comprehend the full scope of tetanus's dangers. As we delve deeper into tetanus, things can get a little more complicated. While we have a general understanding of how tetanus works and its symptoms, much about it remains shrouded in mystery. For instance, not all cases of tetanus begin with the classic symptom of muscle stiffness. The clinical presentation can differ widely depending on the individual and the stage of the infection. It's not as simple as suddenly becoming rigid and unable to move. There is a gradual onset that can take different forms. The manifestations of tetanus vary so much that understanding the disease requires a more nuanced view of how it affects different individuals. There are 4 main types of tetanus that we need to recognize, each with its own unique characteristics. The first type is neonatal tetanus, which, as the name suggests, affects newborns. Though it can occur at any age, it is particularly dangerous and often fatal in neonates. The disease most commonly affects newborns who have not received the proper vaccination or who are born in environments where hygiene is poor and the risk of infection is high. One of the most crucial steps in preventing neonatal tetanus is ensuring that pregnant women receive their tetanus vaccinations. This is vital not only for the health of the mother, but also for protecting the newborn from the devastating effects of tetanus. Ask your mother about whether she was vaccinated during pregnancy. It's likely she was, which helped prevent the risk of passing on the infection to you at birth. Maternal tetanus refers to cases that occur in pregnant women or within 6 weeks following childbirth, often caused by an injury or infection during pregnancy or delivery. While maternal tetanus is not as common as neonatal tetanus, it is still a significant risk for pregnant women who are not vaccinated or who lack proper prenatal care. It highlights the importance of vaccination not just for the infant, but also for the mother, to prevent the spread of Clostridium tetani during childbirth. Neonatal tetanus, which occurs within the first 28 days of life, is particularly fatal if not treated promptly. Another form of tetanus is localized tetanus, which affects the area where the infection first entered the body, such as a cut, puncture, or abrasion on the hand, foot, or arm. While less severe than generalized tetanus, localized tetanus can still be incredibly painful and debilitating, causing the affected muscles to stiffen and contract uncontrollably. Then, there's cephalic tetanus, which occurs when the infection affects the head or neck. This form is typically associated with a wound to the face or neck, and it can cause symptoms like difficulty swallowing, jaw spasms, and even facial paralysis. While cephalic tetanus is rare, it is especially dangerous because it affects critical areas of the body responsible for breathing and eating, posing additional complications. But of all the forms of tetanus, the most feared and most common is generalized tetanus. This is the most severe form of the disease, and it can lead to widespread muscle spasms, severe pain, and life-threatening complications. The hallmark of generalized tetanus is the sardonic smile, a painful and distinctive symptom caused by muscle stiffness in the jaw and neck. The inability to open the mouth or swallow due to locked jaw can make even simple tasks like eating or drinking nearly impossible. Over time, this stiffness spreads to other parts of the body, causing muscle contractions and spasms that are not only painful but can also interfere with the ability to breathe and move. Tetanus can enter the body through any type of wound, no matter how small. It could be something as insignificant as a splinter, a scrape, or even a surgical incision that's been contaminated due to improper sterilization. Medical procedures, in particular, pose a heightened risk if proper precautions are not taken. In any case, once the Clostridium tetani spores enter the body, they begin producing toxins that disrupt the nervous system and lead to the symptoms we've discussed. But the most terrifying aspect of tetanus is how it affects the body's involuntary functions. When the toxins spread to the brain and nervous system, they can compromise basic life-sustaining processes, like heartbeat and respiration. It's not just the pain of muscle spasms that makes tetanus so deadly. It's the fact that the toxins can impair the ability of your body to carry out even the most basic of functions. The muscles that control your heart, your lungs, and even your digestive system can become paralyzed, causing your organs to fail. The good news is that tetanus is preventable. The key lies in vaccination. By ensuring that you and your loved ones are properly vaccinated, you can significantly reduce the risk of contracting this devastating disease. But if you or someone you know experiences any of the signs or symptoms we've discussed today, it's critical to seek medical help immediately. Tetanus is a serious disease, but with proper care, it is treatable. Understanding its symptoms, recognizing the different types, and knowing how to prevent it are the first steps toward protecting yourself and others from this deadly infection. Though I may not be an art enthusiast, there is one particular image that you've likely encountered, depicting a patient suffering from the full wrath of tetanus. This powerful visual is unsettling. A person's spine is arched unnaturally. Their arms are drawn tightly against their body, fully flexed, and their fists are clenched so hard that their knuckles may appear white. The rigidity is complete, and the tension in every muscle is almost palpable. This dramatic image is a typical representation of generalized tetanus, which is one of the most severe and debilitating forms of the disease. The severity of this disease cannot be overstated, and this image captures its terrifying reality in a visceral way. Tetanus is more than just an infection. It's a life-altering experience that can endanger the very systems of the body that we take for granted. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. When we discuss the early symptoms of tetanus, we often mention fever and stiffness as the initial signs, but there's something even more dangerous that accompanies this disease: dysautonomia. Dysautonomia refers to a malfunction of the autonomic nervous system, ANS, which is the part of the body's nervous system responsible for regulating involuntary functions like heart rate, blood pressure, and respiration. When tetanus strikes, the ANS goes haywire, causing a cascade of potential life-threatening effects. The autonomic functions that we usually don't have to think about become erratic, making it extraordinarily difficult for the body to function properly. As dysautonomia worsens, it leads to fluctuations in blood pressure and heart rate that are both unpredictable and dangerous. These shifts put enormous strain on the heart and blood vessels, complicating the treatment process and making management of the disease that much more challenging. But the real danger lies in how the disease progresses further, because as the muscle contractions intensify, they begin to affect the muscles responsible for breathing. The very muscles that keep us alive, those that allow us to inhale and exhale, can become paralyzed and unable to function. This situation places the patient in a critical state, where they can no longer breathe without assistance, and the likelihood of death becomes tragically high. How can you identify tetanus in its early stages? It's not always immediately apparent, but one of the first clues is often a history of a wound or injury, particularly if the wound is not cleaned properly or if it's exposed to the Clostridium tetani spores. The incubation period for tetanus can vary, typically ranging from 1 to 10 days, but symptoms generally begin to show up around the 4th day after the injury. This is when you might start seeing the telltale signs of dysautonomia. If untreated, this condition can last anywhere from 1 to 3 weeks. As the infection spreads through the body, symptoms gradually intensify, often beginning with stiffness in the jaw and neck. These early signs are often mistaken for something less severe, but they should serve as red flags. As the disease progresses, the muscle contractions become increasingly intense, making it painful and difficult for the patient to swallow. In some cases, even speaking becomes a monumental challenge. The inability to swallow properly due to muscle stiffness can lead to severe dehydration and malnutrition, compounding the threat to the patient's health. One of the more peculiar and frightening symptoms of tetanus is something called aerophobia, the fear of air. Although this may seem strange at first, it is a well-known symptom of the disease. Patients suffering from tetanus are so hypersensitive that even the slightest air movement, like a gust of wind or a puff of air, can cause their muscles to contract painfully. For these patients, something as simple as someone blowing air near them can result in intense, unbearable pain. This phenomenon can make even the most basic human actions, like breathing, moving, or speaking, extremely painful and difficult. For the patient, It's best to minimize exposure to any environmental triggers that might cause these spasms. This is why patients are often kept in quiet, darkened rooms to avoid further stimulation. Even light can trigger painful muscle spasms, so the environment must be controlled to minimize distress. As tetanus continues its devastating march through the body, the patient experiences something like continuous, severe seizures. Except these aren't seizures in the traditional sense, but rather painful, rhythmic spasms that can last for several minutes at a time. These spasms are so intense that they disrupt the patient's normal movements, causing deep pain, and often leading to secondary injuries due to the force with which the muscles contract. This kind of agony is an unfortunate hallmark of advanced tetanus, and it serves as a constant reminder of the severity of the infection. Despite the widespread recognition of tetanus and its long history in the medical world, the unfortunate reality is that there is no cure for it once it takes hold. The disease was once believed to be largely under control thanks to vaccination programs, and indeed, the tetanus vaccine has drastically reduced the number of cases worldwide. However, the disease has not been entirely eradicated, and the risks remain, especially for those who don't stay up to date on their vaccinations. While tetanus isn't necessarily the first thing doctors think of when a patient presents with a wound or paralysis, it can still be diagnosed after other causes have been ruled out. The real challenge, though, lies in the fact that the tests required to definitively diagnose tetanus can be expensive, and many hospitals, particularly in less developed regions, lack the resources to conduct these tests. This often leads to a delay in treatment or misdiagnosis, both of which can have fatal consequences. The widespread availability of tetanus vaccinations has certainly reduced the number of cases, but it's still a disease that requires vigilance. In many regions of the world, people may go without access to proper vaccines, leaving them vulnerable to the infection. In some cases, even when people are vaccinated, they may not receive booster shots on time, leaving them at risk. The failure to maintain proper vaccination schedules can lead to serious complications if an injury introduces Clostridium tetani spores into the body. While we have made great strides in preventing tetanus through vaccination, it's critical that we continue to educate people about the importance of these shots. Tetanus is not something to be taken lightly. It is a deadly disease that can affect anyone, regardless of age or health status. And as we've seen, the disease can progress quickly, making it all the more important for individuals to seek medical attention immediately if they suspect they've been exposed to the Clostridium tetani bacteria. Though tetanus remains preventable, we must keep our vigilance high and continue to spread awareness to ensure that more people are protected from this incredibly painful and life-threatening infection. If a patient is suspected of having tetanus, immediate medical intervention is critical, and one of the first courses of action is the administration of tetanus immunoglobulin. This treatment is crucial for reducing mortality rates, but it's important to recognize that while it can help neutralize the dangerous toxins in the tissues, it does not cure the disease. Tetanus immunoglobulin works by binding to and neutralizing the toxins released by Clostridium tetani bacteria, thereby reducing the severity of the disease. However, it's important to note that while this step can prevent further harm caused by the toxins, it does not reverse the damage already done by the bacteria. In addition to tetanus immunoglobulin, the treatment for tetanus is largely supportive. This means that doctors focus on providing the best possible care to help the body fight the infection, manage symptoms, and avoid complications, as the body attempts to heal on its own. Supportive treatment involves carefully managing the most life-threatening symptoms of the disease. For example, patients are closely monitored for respiratory failure, as the muscle contractions caused by tetanus can eventually affect the diaphragm, making it difficult to breathe. Ventilatory support, such as mechanical ventilation, may be necessary to ensure the patient's airways remain open and that oxygen is delivered effectively. Another critical aspect of supportive care is managing muscle spasms and preventing seizures. Tetanus causes extremely painful and often violent muscle contractions that can result in fractures, muscle damage, and dislocations, in addition to the immediate discomfort. In severe cases, these spasms can occur every few minutes, leading to exhaustion and further complications. Medications like benzodiazepines and muscle relaxants are often used to help manage the muscle contractions and reduce the risk of seizures, which can also be triggered by the pain. Unfortunately, there is no cure for the infection itself once it has taken hold. The only way forward is supportive care until the body can fight the infection and neutralize the toxins naturally. What makes treating tetanus even more challenging is the fact that Clostridium tetani spores are remarkably resilient. These spores can survive in a wide variety of environments, including in the soil, dust, and even on the surfaces of rusty objects like nails and needles. In fact, tetanus is resistant to most antiseptics available today, which means that simply cleaning a wound with alcohol or hydrogen peroxide may not necessarily reduce the risk of infection. While these substances may be effective at cleaning other types of bacteria, they do little to neutralize the spores of Clostridium tetani. The best and most effective way to clean a wound to prevent tetanus is with simple soap and water. Thoroughly washing the wound with water helps to remove debris and bacteria, including any Clostridium tetani spores that may be present, reducing the likelihood of infection. If you are still watching this video and find these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. It's important to understand that while you may be tempted to reach for antiseptic products like hydrogen peroxide or alcohol, they don't kill the spores that cause tetanus. In fact, these products can sometimes harm the tissue in the wound, delaying the healing process. Using water and soap is your best option when it comes to preventing tetanus after an injury. The good news is that tetanus is preventable through vaccination. In fact, as long as you stay on top of your vaccination schedule, you don't need to worry about tetanus. The tetanus vaccine is highly effective and is a part of the routine immunization schedule for both children and adults. However, if you haven't had a tetanus booster in the past 10 years, it's essential to get one as soon as possible. Tetanus cases are still being reported, especially in certain populations such as children, the elderly, and those who have frequent exposure to situations where cuts, scrapes, or puncture wounds are more common. In fact, reports have been rising in certain areas, with tetanus cases particularly affecting older adults and children who may not have received the appropriate booster shots, as well as individuals exposed to environments or activities that increase the risk of injury. This highlights the importance of staying up to date with vaccinations, not only for your own protection, but also to reduce the spread of preventable diseases. The key to protecting yourself from tetanus is simple: vaccination. If you are unsure about your vaccination status or haven't had a tetanus booster in the last decade, it's a good idea to check with your healthcare provider to get one. If you are unsure about your vaccination history, you can ask your healthcare provider to check your records, or even ask your mom to see if she has your vaccination record. It's a small but important step to ensure you're fully protected against this potentially deadly disease. You might be wondering, can tetanus resolve on its own, without treatment? Unfortunately, the answer is no. Tetanus is not a disease that can simply heal itself with time. Without proper treatment, tetanus can affect the body's ability to perform vital functions, such as breathing. If the infection progresses far enough, it can lead to respiratory failure, where the patient can no longer breathe independently, putting them at extreme risk for death. This is why it is absolutely critical to seek medical care immediately if you or someone else shows signs of tetanus, particularly if you have a wound or injury that may have been exposed to Clostridium tetani spores. Starting the year right means paying attention to your health. Make sure your tetanus vaccinations are up to date, and if you haven't had a booster in the last 10 years, don't wait, get one now. It's always a good idea to check with your healthcare provider about your vaccination status. Tetanus may seem like an old, rare disease, but in reality, it's something that can affect anyone, especially if proper precautions are not taken. As a final reminder, it's actually more common to get tetanus from something as simple as falling or scraping yourself than it is to get it from stepping on a rusty nail. Everyday accidents can expose you to Clostridium tetani spores, and if you're not protected, you could be at risk. Take control of your health by staying up to date with your vaccinations, and encourage others to do the same. By being proactive, you can significantly reduce the risk of contracting tetanus and ensure that you and your loved ones remain safe and healthy. Thanks for sticking with us through today's deep dive into the hidden dangers of tetanus. So, what have you learned so far? From understanding how tetanus spores spread to discovering how this deadly disease can silently attack your body, there's a lot to take in. But now it's time to hear from you. What's one thing you've learned that you're going to put into practice to stay safe? Please share your thoughts in the comments below. And if you found this video helpful, don't forget to give it a like, share it with others who might benefit, and subscribe to our channel for more essential health insights. Your support helps us continue bringing you important content like this. Stay safe, stay informed, and we'll see you in the next video.